Chapter 41, Assisting in Geriatrics. So geriatrics is the field of medicine that is concerned with conditions related to aging, those specifically over the age of 65. It's also a subspecialty of internal medicine and family medicine. Fun fact, by the year of 2030, 20% of the United States will be of that age bracket or older. So the next 4 or 5 slides, we're going to talk about different changes that happen in each one of your systems in your body. So this one are the physical changes that happen with your integumentary system or your skin. So you'll have the thinning and wrinkling of the skin due to the decreased collagen. And then the elastin amounts that are in your dermis start to decline as well. So everything starts to kind of wrinkle up and shrivel. You also have atrophy or degeneration of that subcutaneous level, which is your adipose tissue. That starts to droop. So you see a lot of like earlobes, the skin under your arm starts to hang down because it's not as tight as it used to be. You also get the decreased number of your melanocytes, which are your pigments. Those melanocytes help protect against the UV light. So if you have a decreased amount of those, you are more susceptible to getting skin cancer, sunburns, anything that has to do with the UV lighting. You get graying, thinning hair, your brittle nails, because the keratin that's in your fingernails that makes them nice and strong starts to get diminished as well. And then you also have a decreased inflammatory response. That if your inflammatory response is decreased, that means the way you heal starts to slow versus when you were younger. You were able to heal a little bit quicker from injuries, surgeries. If you're older, you take a little bit longer. So the aging in your nervous system, that is where all your chemical reactions happen. So you have a slower reaction time. You have decreased blood flow to the brain due to arteriosclerosis. That means all the arteries that can be either in your brain, your heart, they start to thicken due to like their diet. You get calcium deposits on the walls or the vessels so that the blood flow cannot go through those vessels as easy as it used to because now they're thinner. Your frontal lobe starts to decrease. So that means your attention span is less. You have shrinkage in your temporal lobe. When your temporal lobe starts to shrink, that means that's where all the brain processing happens. So you have weaker signals for them to order to process new ideas or new skills. Your fine motor skills start to get impaired. That is caused by the shrinkage of your substantia nigra, which is your fine motor skills can be your writing, playing piano, knitting, anything that has to do with like your fingers and fine motor skills. And then you tend to notice a lot in elderly patients, their memory losses. Usually it's your short-term memory. Elderly patients do tend to have a better memory or a long-term memory than the short, and that is due to the hippocampus part of the brain starts to shrink up a little bit. And then also the acetylcholine, which is kind of like the energy part that helps those electrical signals in the brain, you start to have a decreased amount of that. So that means the chemicals that transmit all those electrical signals between the cells isn't as, ample as it used to be. So the aging process with your special senses, your hearing, vision, and your taste, pretty much in this slide. So as you get older, you do know that your vision and hearing start to decline a little bit, just because of all the degeneration of your vision sensors, your hearing receptors, all of those start to decline. A lot of it's due for the hearing aspect is just the torture, I'm assuming, that you put your ears through over the course of your lifetime. Loud music, things of that nature, but it also does happen because the tympanic membrane starts to get a little bit smaller. Your inside of your cochlea and all the inner nerves start to lessen as well due to all the acetylcholine that we talked about in the prior slide start to decrease as well. And then you also have your altered taste sensation, which is a lot, your taste buds start to decline. Patients can be on lots of medications that will alter their taste sensations as well. That can contribute to dehydration, and in worst case scenarios, it could be possible malnutrition. So this is just a goofy slide. You know, as you get older, you tend to shout at people. And then the aging process with your musculoskeletal and your cardiovascular. So with your musculoskeletal system, there's different conditions that happen. So one is your osteoporosis, or as porous bones. So they're kind of holy. So you have the decreased bone density. So what happens is your bones aren't as dense as they used to be. So that gives you a higher risk for fractures and broken bones. Mainly in older patients, it's hips and knees. They're the more weight-bearing, sections of the body. And then you have osteoarthritis. So that's a degenerative joint disease that's affecting the joints. And then you have decreased numbers of your musculoskeletal fibers. So that means they can work out, but they will not be able to build as much muscle mass as they were when they were, 20 and 21. And then with the cardiovascular system, your cardiac output is decreased. A lot of that has to do just with diet, your whole history of life, how you have taken care of your body. Another one is the arteriosclerosis, which we talked about in the nervous system. If you don't take care of your heart from a young age, you start to get those calcium deposits on the inside of your heart, which makes those blood vessels smaller. So that blood flow starts to decrease. Then there is postural hypotension. So that is a condition when you have loss of blood pressure when standing up or sitting down too quickly. So basically it's just that person's body cannot adjust their blood pressure quick enough because they've stood up or sat down. Their body kind of gets dizzy, they faint sometimes. So you have to just make sure you tell your patients of that when they get to that stage that they need to get up slowly, sit down slowly. And then the other one would be increased risk for heart disease. So I put a little diagram down here. Their heart might not pump as efficiently. Their blood pressure may increase. That's due to a lot of their dietary need, their dietary history. The veins start to get a little bit smaller due to all those plaque deposits. So it's not efficient enough to return the blood back to the heart. And then the blood flow to the brain and vital organs may be decreased. All right, moving on to the respiratory and immune system. So things that will happen with your respiratory system. So you start to lose the elasticity in your lungs, which means like a rubber band, they have the elastic that's able to stretch, further out. You start to lose that. Your intercostal cartilage, which is the cartilage that's in between each of your ribs, starts to get hard. So when that happens, it makes it harder to breathe. It also kind of makes elderly patients kind of hunch over a little bit, giving them the condition called kyphosis or humpback. Due to the calcification of that cartilage, it increases your shortness of breath. And it's also caused by, other physical conditions that we talked about in prior slides. So things that happen with your immune system, just like with any other bodily system, it starts to break down. So you're more susceptible to diseases because your immune system isn't as healthy. You're more susceptible to other autoimmune diseases, such as cancer or rheumatoid arthritis. So your aging, digestive, and urinary systems. In your digestive system, you start to get a little more constipated due to like your poor diet, lack of exercise, or medications that they're taking. Unfortunately, you get this condition called fecal incontinence because the muscle tone that will help keep the fecal matter inside of your body starts to loosen. And then with your kidneys, your nephrons decrease, which is the functioning unit of those kidneys. So your kidneys aren't able to filter blood as quick, so it's a little more of a slower process. A lot of that does have to do with medications they're taking, the way they've taken care of themselves through their life history. So when your kidneys can't filter out things as quickly, it does cause them reduced tolerance to certain medications and illnesses. And then it's the same as the fecal incontinence. You do have urinary incontinence as well, which is they slowly lose the voluntary control of their urination. A lot of the muscles that hold the urine in there starts to get really weak. So if they jump, run, sneeze, anything that causes like motion in that area, they will tend to leak out a little bit. So I did kind of post another little diagram here. So the changes, you can have decreased kidney mass, blood flow. The implications of that, your renal function is reserved. You're in higher risk of getting renal complications. Your bladder elasticity is reduced. Your muscle tone capacity. Your increased post-void residual or your nocturnal urine production. So what that means is you can go to the bathroom all day long. You're supposed to completely eliminate all urine from the bladder. This condition is kind of called post-void residual, meaning your bladder does not completely empty. And then what happens is when you're sleeping and your body's totally relaxed, you get nocturnal urine production. So it kind of lets you're basically urinating on yourself while you're sleeping. And in male, some of the changes would be like their prostate starts to get a little bit larger, which the prostate sits right behind the bladder, and it'll start to press on the bladder, making them urinate when they're sleeping. So some of the risks that can happen, you can have incontinence, you have a higher risk for UTIs, bladder infections, all because the urine is sitting inside that bladder longer than it should be. Issues or your aging endocrine system. So what happens as you get older with your endocrine system, you have a decreased thyroid. You get loss of estrogen, and you have decreasing levels of aldosterone, which is your blood pressure regulating hormone. You have an increased time for recovery, which we talked about in previous slides, so that your level of cortisol starts to take a little bit longer to come into effect after stressful events. And then you start to have deficiencies in the response to insulin by your organs. So I did have another slide here. Changes. You have your impaired glucose, your decreased thyroxine. You can have reduced testosterone, estrogen, your ability to absorb vitamin D, which will cause osteopenia. And then just different implications that happen with each one of those conditions is also posted here. So your psycho-emotional and social development as they get older. So in Western cultures, retirement usually starts about 65 to 70 years of age. Sometimes it's a good thing, sometimes it's not. It just depends on, my dog's barking, how well, if they're prepared themselves financially, it could be a good thing or a bad thing. Unfortunately, as people get older, the death of the spouse and their friends are more common. Physical ailments and ability to physically and mentally do what they used to be able to do can lead to depression. And then depression can also happen because they don't want to have their family members be they don't want to be completely dependent on their family members. If they were used to being independent, now the fact that they're relying on other family members can affect their psycho-emotional development. Usually as they get older with the social development, their increased spirituality, they start to live independently. They will learn to live independently by going to retirement communities, nursing homes. They do start to get a little more independent by having social groups and bingo clubs, and they can volunteer, which can help their social development. And then grandchildren is a huge way of their social development to be intact. So all of us probably have grandparents at some point. You need to, just kind of go with them, visit with them. It makes them feel 100%, that they're loved, that they're thought about. And this little diagram here just says, thinking about my grandchildren always makes me smile. So different aspects of care that you have to think about when taking care of elderly patients. You want to make sure that you're encouraging them to socialize, encouraging them to continue with healthcare checkups. Make sure you're encouraging them to do weight-bearing aerobic exercises. The use it or lose it phrase, like if they don't use their brain, they're going to use it. So start to have them keep their brain active. Crossword, magazines, doing games on their phone that keeps their brain active. Helping them keep their sleep patterns healthy. And then just educate them on healthy diet or eating habits. I know as they get older, some patients don't have enough money to afford the healthy foods, but there are ways that you can kind of tell them, okay, maybe if you go to like a restaurant, you don't order the highest caloric value of food. You can get a small steak with broccoli and applesauce instead of a small steak, French fries, and a potato. So you kind of give them different options on how to have better eating habits. So then I pulled a slide that was on from McGraw-Hill. So there's different diseases and disorders that geriatric patients tend to have. One of the ones that you guys have probably heard about is Alzheimer's. So that's when it affects the brain, obviously, but it also affects your personality, the mood, the behavior, the memory loss, increased forgetfulness, different things that they used to be able to do with familiarity starts to diminish. There's no cure for that. The primary caregivers, all you really can do is just comfort them and make sure that they're, trying to be active as possible. Medications such as Aricept and Namenda are able to slow that process down of the hardening of the arteries in the brain, but it won't cure it. And then we know about cancer, so that's an abnormal growth of the cells that kind of invade other tissues. Treatment is surgery, chemo, or radiation. Sometimes if they're too weak to abide by the side effects, sometimes those options aren't available. So it just depends on how well they are off, if they're able to handle a lot of those conditions. Cardiovascular diseases would be coronary artery disease, dysrhythmias, which is your abnormal heart rates, cataracts, so that affects the eyes. So that's when the lens of the eyes, they're supposed to be nice and clear. But as you get older, they become a little bit cloudier and like an opaque color. And that causes your vision to decrease. You can tell them to wear sunglasses, improve the lighting that they are in, changing of the glasses that they have. And then there is a surgery that can replace the lens. And then you have a condition which, unfortunately, a lot of elderly patients like to talk about, is their constipation diarrhea cycle. So this kind of happens with a lot of medications they're taking. So if they're taking like opiates or something to reduce pain levels, that will make them constipated. And then they take medications to relieve that constipation syndrome, which is laxatives, stool softeners, eminas. And then that process is the diarrhea cycle. So that process just kind of keeps going over and over and over again because they have to take those pain medications, such as their hypertension, their diabetes medications, their congestive heart failure medications. A lot of them do cause constipation. So they're relieving those symptoms by taking the enemas, the laxative stool softener. So that process just kind of happens over and over again. Then you have your diabetes mellitus type 2, which is your high levels of sugar or glucose in the blood. Hypertension is your high blood pressure. Hyperlipidemia is when you have high cholesterol levels. Osteomalacia is when your bones are softening because the vitamin D absorption is declined. And then osteoporosis, which we talked about, is thinning of that bone tissue or loss of bone density. And then one other condition that I found on McGraw-Hill would be your sleep apnea. So that's a condition where the person actually stops breathing for several seconds at a time while sleeping. So if it's not treated, it actually can lead to serious complications such as strokes, cardiovascular disease, depression, and even memory loss because your sleep cycle is all off. Things that you can educate your patients on if they have this condition: avoid sleeping pills, avoid sleeping on the back, avoid smoking, alcohol, and try losing weight sometimes. There is a machine called a CPAP, which kind of gives the patient continuous flow of oxygen into the nose to keep that airway open. There are many, many different kind of CPAPs, so they would have to talk to their physician about the one that is most beneficial to them. So, assisting with geriatric care, which just means if you have a patient that's of geriatric age in the office, if you're a home health care nurse or aide, there are certain ways that you want to approach an elderly patient. You don't want to stereotype all elderly patients as being frail and confused, because most of them are not. Always treat geriatric patients with respect. They are your elders. You want to speak in a low pitch, clear tone. High pitched voices are more difficult for hearing impaired patients to understand. Try to put all your instructions that they need in writing. It's very beneficial for them to remember, and then if they need to speak with family members later on, they have a visual printout of the instructions. And then adjust all procedures to fit each patient. Some patients might understand the instructions, some might not. So you kind of have to give a little leeway on each patient that you have and how you're going to treat them. And then assisting with geriatric care. So you have denial or confusion. So a lot of elderly patients will either deny or be totally confused about their illness. Elderly patients may often overreact to a problem and consider themselves sicker than they really are. They may also over or underestimate their ability to perform certain tasks or to deal with certain limitations. They're so used to doing something a certain way, it's extremely hard for them to be told that they are not able to do something anymore. They often may be confused if they have an impairment with memory, judgment, or mental abilities. So just also keep that in mind when you're talking with them. Just some of their judgment may be off. Importance of touch. So therapeutic touch in elderly patients is extremely effective. It's the hands-on, using direct, putting your hands on human people. It is a direct way to, the energy from your hands to help heal them. There's no scientific evidence to prove this therapy, but is known to improve the health and well-being. Giving a hug, a light little hand on the back, just giving them the human contact does wonders for a lot of elderly patients. A lot of them could be not have family members, not have anybody in their lives that will be in contact with them. So if you are in the geriatric field, it is very important that you just have direct contact with them. And then the other portion of the slide is incontinence. So it is your involuntary leakage of urine. Many elderly patients may be embarrassed to ask for help. Incontinence can lead, if they are not asking for help in this aspect, it can lead to many infections that can cause UTIs, bladder infections, kidney infections if not treated. So if they're afraid that they're going to pee themselves, for lack of a better expression, they may tend to drink less fluids, which in turn will cause them to have other conditions as well. And then preventative medicine. So that is measures to prevent illnesses, making sure they know about their mammograms and colonoscopies in male, or mammograms and colonoscopies. Sometimes patients will have lack of compliance when taking their medications. They forget, they don't want to take it. Kind of get them one of those pill reminders, write things down when they're supposed to take their medications, set little alarms for them. Make sure that they understand the importance of taking this medication. So if you have to collect a urine specimen, so sometimes it's a little bit harder to collect a urine specimen from older patients because their bladder muscles weaken with age. So sometimes if you ask them to get a sample, they might not be able to. Often leading to, if you are not able to empty the bladder all the way, we talked about this in a prior slide, it can, lead to UTIs, chronic urine retention. And then there's also that condition called nocturia, which is excessive nighttime urination, which if you're getting up to pee 4 or 5 times a night, it also affects your sleep cycle. And then you have prolapse. So that is when you lose the support of due to the weakening of the wall. So your uterus will actually kind of start to work its way down into the vaginal canal. There are different surgeries that they can have the kind of a sling that will hold the bladder up so that doesn't happen. But a lot of this for the prolapse is mainly in females that have multiple birth. Your bladder and all those organs get displaced during vaginal deliveries. So it does, your walls start to get a little bit losing the support. And then, so assisting in geriatric care when you're using hot and cold therapy. Elderly skin, as we talked about before, they don't have the same amounts of adipose tissue that we do. So you have to be really careful when applying cold and hot treatments onto their skin. They will get cold a lot faster. They will heat up a lot faster. So just be very cautious when administering any kind of cryotherapy or thermotherapy. And you'll notice in this picture, she's got the fan on, she's hot, the sun's on. It just happens when you get older. So the main part of this slide is just to make sure that you're remembering they're going to get cold faster, hot faster. It takes them a little bit longer for their circulatory system to adjust to the changes. All right, so your nutritional guidelines as they get older, patients get older. So science states that people over the age of 50 should start decreasing their caloric intake by 10% compared to younger adults. Men and women over the age of 75 should start decreasing their caloric intake by 10% to 15%. This means they're not eating less. That just means the calories they're intaking are healthier, so their protein values don't change. That means that elderly patients should select food now that's higher in protein, just a smaller amount. Elderly patients should keep their fat intake to about 20% of their total calories. So some of the issues that could happen with that, with their eating habits, they have dentures, they have lack of appetite, medications, and depression can make this task difficult for them. And then the immunizations that elderly patients should take, or have rather. They should always get the influenza, and they should always get their shingles. So their influenza vaccine helps them from getting the flu. If they get the flu, that can lead to a lot of pneumonia type of related symptoms. And if you have those conditions, as we talked about with other things that happen as you get older, getting pneumonia as an older patient is a lot harder to treat versus a younger patient. The shingles vaccine, or Shingrix as it's called now, as you see in the bottom corner, is just a lot of patients who are not, I think it's 20 or 21, that were not vaccinated for the varicella vaccine, which is your chickenpox. So patients 21 and older didn't get that vaccine. So that means they probably got chickenpox at some point in their life, which also means that if they come in contact with somebody that is carrying the varicella virus, they will become more susceptible to getting it again. So the shingles vaccine, or Shingrix, will help prevent them from getting it again. However, when you get varicella or shingles when you're older, it's a lot more painful, and you get these big nasty rashes on your torso, which just take a lot more, time and dedication to treat them. You can also inform them that Medicare Part B does cover the cost of those two vaccines. So there's no discussion about they can't afford it. And then different concerns that you want to have with geriatric patients. You want to help them to prevent falls in their home. So when a lot of, like we said with the special senses, you want to make sure they're removing their reading glasses before getting up and walking around. If you've ever had reading glasses on and you try to walk around with them on, your depth perception is off. So you want to make sure that you're telling them to take them off before getting up. You want to make sure that their home, all their walking areas are decluttered and they're well lit. You can tell them to put night lights in the bathroom and in the bathrooms. And then make sure they're using caution when getting from a reclining position or recumbent to allow the blood pressure to adjust so they don't get that hypotension issue. Making sure they're wearing non-slip shoes or well-fitting low heels. Using a cane and walker if needed. And in the bathroom area, make sure you install the bathtub handrails, in the actual bathroom stall or near the toilet. And then depression, making sure you're recognizing the symptoms of depression. It could be different for elderly patients versus younger patients. What happens with them, like their spouse dies, a lot of their friends die, their family moves away. So depression is a lot more common with elderly patients. It can decrease their ability to enjoy life, slower their thinking, or their difficulty in making decisions. Reoccurrent feelings of worthlessness, exaggerated feelings of sadness, hopelessness, or anxiety, and then reoccurrent thoughts of death or suicide. So the challenges with treating older patients with depression, they may be tired all the time because it takes a lot more energy for them to move around. They can, transportation limitations, sensory deficits, cognitive changes, physical changes. Yes, in a normal younger person, they can treat a lot of those conditions that happen. But as you get older, some of those conditions can't be treated. And it just leads to them being more depressed than they normally would if they were younger. And then I want to make sure you guys know about different concerns with the elderly, about the elder abuse. So there's 3 basic categories. You have your domestic, your institutional, and then self-neglect. So the domestic would be at home. So history of violence in the family, alcoholism, or drug abuse does lead to higher domestic abuse. Isolation of the victim from the family members and friends from the abuser. Most elder abuse victims are older women with chronic illnesses or disabilities. The institutional abuse would be the ones that happen in the nursing homes or in the hospitals. And then self-neglect would be part of that depression that they have. So signs of that self-neglect would be dehydration, not wearing the proper clothes for the proper season, unsanitary or unclean living quarters, homelessness, lack of the necessity of medical aids, and then untreated medical conditions can all be signs of self-neglect. If you have a patient in your care or have a family member that is of that age, make sure you notify somebody if any of these signs of self-neglect are there. And then the last slide, so you have your polypharmacy. So this kind of happens when they're taking several medications all at the same time. So many elderly patients obviously are seeing different doctors. So it can be possible that a doctor will prescribe a medication not knowing if it's going to interact with another medication that a different physician has prescribed. Sometimes it is safe, as long as all doctors know the full patient's drug profile. It's a little bit easier now because we have the EMR systems. If you go to Rite Aid or Walgreens, they have your prescriptions in a national database. Or if you go to Christiana, Wilmington, different hospitals, all your information is on one system. So it's a little bit easier now to kind of avoid the polypharmacy effect. However, it still does happen. Try to stick all your linkage or your care to one hospital, such as Christiana Care, and then try to stick to one pharmacy. That will kind of help eliminate a lot of the issues that do happen. So a doctor, let's say you're getting treated for hypertension, they're going to prescribe you like lisinopril or metformin. And then if you go to the emergency room for a UTI and they prescribe you another prescription, if those two EMR systems aren't linked up, and let's say one of those prescriptions that either one of those providers gave you, they could interact with one another, causing a severe reaction. So just always make sure that they have a list of all the medications they are taking, whether or not in the EMR system. Just make sure they maybe have it written down like on a index card or something if they go to different providers. But there are the top 5 medications that are severely potentially dangerous. You have your benzodiazepines, your antidepressants, your muscle relaxants, and any anti-epileptic or anti-seizure medications. So that is your chapter on 41, Assisting in Geriatrics. Thank you guys for your time, and I will see you guys. Thank you.